Whoa! Run away! All I can see is the hands, right? They're in an interesting position, so I'm assuming they're pushing. We actually do a neurologic test where we force somebody's hand like this, and then if they actually have this tick, it's called asteristics. Nice. Pretty smart. But imagine a massive, heavy box falling on you and your body just bends in half like that, so you snap your vertebrae in half. I've actually literally seen people snap their vertebrae, become paralyzed. Typically, they have to do with like falls from really great heights and landing on an uneven surface. Whoa, go, go, go. I've actually seen injuries come to the emergency department from these type of machines, like no joke. What ends up happening is somebody gets caught, maybe a piece of clothing, a piece of equipment, and I've seen people's hands get torn off or fingers ripped off. Oh, no. What have you done? I've never seen anybody die from this, thank goodness, but you have to be really careful with any heavy machinery. Should they have safety measures on there? Yeah, they probably have them, but stuff potentially could still happen. If you lose an appendage, something gets cut off or amputated off, bring it with you. This circumstance, there's nothing potentially to put back. Obviously, if this happens while you're at a job site, get the patient to safety first. Try to stop the bleeding, either tourniquet or a significant amount of pressure gauze to the area. Get the person to the closest emergency department. Interesting, they have like restricted access. If you guys ever walk around the hospital, you'll see signs everywhere that's like staff only, restricted access. It's actually quite interesting. Like I have a badge at the hospital that it's actually set up to only allow me in certain areas. Oh, whoa, wait, is that a leg going flying? What is that? It looks like directly at the knee. We typically have AKA or a BKA. The knee is made up of your kneecap, proximal part of your tibia, and the distal part of your femur. Wow. Hanging by your wrists in that position can cause significant amount of pain, not only to the wrist, but to the shoulder joints, to the muscles of the chest and the rotator cuff of your shoulder. Oh. We do see this happen in the emergency department occasionally where blood just gets splattered everywhere, or even patients spitting, patients throwing poop, throwing urine, vomiting. There's a lot of different liquids that get thrown around that could end up on walls, the floor, on people. Whoa, we got some new hands. Cool. Say you have a prosthetic and have the ability to change out different types of prosthetics. I know individuals who say are runners, they have like a normal like leg prosthetic and then they have their running one. That's like the blade. I know people have probably seen those. As technology gets better moving forward in the future, there are a lot more options that are coming to fruition. And there could be a point where they have the ability to be controlled by your brain. Oh, we got some electrical energy. Injuries by electricity. Typically, the only time we see electrical type injuries, work sites or somebody's accidentally like hitting an outlet. Most of the time they're low energy and they don't cause significant amount of issues. Just like when the law enforcement uses, say, a taser or those barbs that shoot out and would tase somebody, that is typically within the soft tissue itself, not causing cardiac arrest or any long-term damage, more just causes incapacitation for a very short period of time and discomfort. When they do come to the emergency department, a lot of times those barbs are still stuck, so we have to remove those with force because they'll just come right out, or we have to actually cut them out. If somebody comes into the emergency department with an electrocution type injury, we also want to check to see if there's any breakdown of muscle tissue for rhabdomyolysis, checking out a CPK level. And then obviously we want to check their kidney function as well to make sure it's not getting clogged up due to muscle breakdown. We went from a shock to on fire to being burned. Electrical injuries could cause burns on the inside, but then you do have burn injuries that we do worry about outside of like 1st degree, 2nd degree, 3rd degree, 4th degree burns. You worry about when the burn is that bad that it's engulfing around the individual, that they're breathing in the flames, causing airway disruption, causing melting of the tissue, causing swelling of the tissue, and then taking the oxygen away so you actually can't breathe. Not so much. Whoa! Wow. This one was crazy. What crazy apparatus. It almost looks like Wolverine's claws. Stab right through. Maybe the head is where the motherboard is for these toys and creatures. But again, same thing for humans. But if you stab too low, if you're going through the mouth in a human, you're going more like brainstem and lower part and cerebellum versus like the higher functioning part of your brain, which is higher up in the dome up here. If you have an injury to the brainstem, that's where your autonomic nervous system helps to communicate to everything else, and you might not have function of your ability to breathe or have a heartbeat. We at the hospital do have devices to actually help lift patients, especially if they are a little bit too heavy for an individual lift, because then you don't want to increase the risk of hurting somebody else. If somebody, say, has dead weight, not that they're dead, but they don't have the power to help themselves to lift, that is heavy. Individuals anywhere between 100 to like 500 pounds, yes, you can really hurt yourself because they're also in a bed or in a chair and you're using abnormal mechanics to be able to help them up. So if somebody's trying to lift somebody up from their jaw with their hand in their mouth, would there be any injuries? Maybe some teeth coming out. The jaw would probably stay intact, especially the upper jaw, which is your maxilla, which is attached to your skull. Oh, cool. We got a brain. So they've done a good job. You can actually see the different lobes of the brain. So you have the frontal lobes, you have the temporal lobe, parietal lobe, occipital lobe. That makes up the cerebrum. Underneath, you see something that's a little bit different color. The cerebellum, the balance center of the brain, and then you're seeing the spinal cord come out the bottom. We're seeing a lot of electricity relating to this and energy, trying to maybe activate it, shock it, or harness the energy. In the emergency department, we use energy to restart somebody's heart out of an abnormal rhythm. Oh, they're activated. We would have this happen every now and then. Generators or the backup power in the emergency department, the power might go out or a surge, but there's always backup power at the hospital. You definitely have to keep people on ventilators and have pumps relating to medications that have to stay on for individuals. Saved. Oh, what happened to the brain?
Hey, what happened?
It flipped upside down. Now you're seeing the cerebellum.
You and Poppy! It's all your fault! Want to kill you!
Patients that come to the emergency department who are having acute psychosis, they're responding to different types of internal stimuli and they're aggressive. What medications do we give? Do we give them a shot of medications and hold them down to be able to get it in and then have to use restraints and a lot of security? If we can use pills and calmness, that's what we want to do.
Kill everyone who hurts me!
Looks like probably liquid nitrogen, super cold, freezing agent. All I can think about is Terminator 2.
Hasta la vista, baby.
I tried to be better.
Oh, crush injury.
Smart enough.
Crush injuries, they're a real thing. I've seen them many times come into the emergency department, and sometimes we'll have a simple crush injury to the distal end of your finger. People slamming in a door. There's not much to do. We'll put you in a finger splint.
Not good enough. Not.
When it comes to crush injuries, the tissue ends up exploding open. We have to kind of put the meat back together and try to close it up. We'll get x-rays to see what the bones look like. If the bone is fractured with this type of crush injury and it's open, it's called an open fracture, and it increases the risk of infection. So we'll put somebody on antibiotics.
I'm sorry. I'm
I would have to worry about renal failure and rhabdomyolysis and hyperkalemia. What the hell does all that mean? The cells break down, they're destroyed. The potassium is inside of the cell. You get too much potassium into the bloodstream, you start getting into levels where it can cause cardiac arrhythmias. Oh geez, what is that? Yeah, run. Nice, new objective, run. Horror games like this, it really makes me think being in the ER isn't all that different. It's actually why I formulated Chillax by my company Life Happens, an occasional stress support supplement. Check it out at lifehappens.com or on Amazon. The pain of a burn is so bad. 1st degree, 2nd degree, 3rd degree. Don't see 4th degree that often. Even 3rd degree where they say, okay, you burn through all the nerve endings and it doesn't hurt anymore. There's still some surrounding 1st and 2nd degree burn on maybe the edges of those wounds or in different areas. This type of burn, it's engulfing the whole body, which means that all the oxygen is being taken away, as well as the pain will cause you to potentially scream, and you're going to try to breathe, and you're going to inhale the fire, which then increases the likelihood of melting or burning the mucosal membranes. In circumstances where somebody has significant amount of burns,
Badly burned.
and they're around the head and neck area, and say we see like some soot around the posterior pharynx, or you see a lot of singed hairs around the face, we really think about intubating somebody sooner than later, because what happens is that swelling might kick in when you're not aware. Patient starts feeling discomfort, and by the time you get everybody to get all the equipment to intubate, it might be so swollen that you can't get the tube past all that tissue. I'm only laughing because the character's like looking up, down, like, where'd they go? Falls from great heights, fracture, dislocate, massive traumas, just different scenarios. So you can have a significant amount of injury on falls that are, you know, twice your height, 3 times your height. So just be aware of that and be careful and know your surroundings. Oh, the dinosaur. Head injuries are so common. Your head is super important, so please be careful. Somebody falls because they pass out and then they hit their head. That's a common issue that we see often. When somebody comes to the emergency department, you're gonna get some pain medication. We'll ultimately get a CT scan of your head. And if you're having neck pain, we'll get one of the neck. Look at that neck! Oh, whoa, whoa, whoa. So some of the red stuff, I wasn't expecting to see that. Sometimes with this amount of trauma, you get a CT scan of the face because you're looking at the orbit, you're looking at the sinuses, you're looking at the mandible. So you're looking at all these different structures to make sure that there's no fracture there.
Now that hit the spot.
Eating maybe your own kind, not a good idea.
You're talking about cannibalism.
If we eat other humans, we have risks of multiple diseases. One's called prion, one's called Creutzfeldt-Jakob disease, and then you have to worry about bacterial and viral illnesses, as well as like heavy metal issues.
I haven't eaten weeks.
Also, going weeks without eating, probably not the best idea. Now, people have done long water fasts, but please make sure you do it under the supervision of a doctor. That way you're getting hydration, your appropriate electrolytes, maybe if you need vitamins.
Hiya there, pal. Don't worry, I won't eat you.
Oh my goodness. For all those survivalists out there, just remember the rules of 3. 3. Can't go 3 minutes without air, unless, you know, you can hold your breath that long. Then you can't go 3 hours without the appropriate shelters if you're in extreme weather conditions. The classic is 3 days without water, 3 weeks without food.
I was told to expect you.
Ooh.
This way. Follow me.
Just the sound of like the sloshing in the abdomen, that liquid sound that you hear. We have liquid within our stomachs, small intestine, and then the liquid of our body starts getting really reabsorbed in our large intestine.
What did you do with them?
First off, I gotta talk anatomy. If we could just look at the hand, even though it is huge and no flesh over top of it, it's actually pretty accurate to a point. Further down at the forearm bones, and you actually have 2.
I built us a home and kept us safe.
and you repaid me by bringing in an outsider.
Whoa. We can look at the mouth and see that there's a ton of teeth. We have multiple types of different teeth. Incisors, you have canines, you have premolars and molars.
I see now. This was my fault.
Being lifted up by your head, you're gonna have potential disarticulation of the joints in your neck. You do have to be really careful.
Can make better.
Ooh. Facial trauma. What are the common areas that I end up seeing at the hospital? Usually it's related to the mandible, which is this jaw. Sometimes people will get punched in the face and they'll fracture it on one side and actually fracture it on the other. There's two different impacts.
Don't
Touch me.
Oh, whoa, we got a lot of the red stuff. Whoa. That amount coming out of the body, that's not going to be good. If we see people who do have massive bleeding, we do characterize it by the amount of blood, but sometimes you can't do that.
I can't do that!
You do it based on people's symptoms and something called hypovolemic shock. Oh, we're getting high. We're about to fall from a great height. Uh-oh. If you were to fall from that height as a human, it's more than 2 to 3 times your own height, which increases the risk of injuries. Trauma activation, and you're gonna get a full head-to-toe assessment. You do airway, breathing, circulation, disability, and exposure.
This is how you repay.
Oh, geez. Oh, my goodness. Oh! You see her just flop and land directly on her face. It actually is so common. People will fall, trip, and you try to put your arms out to brace your fall, or you passed out before you fell, thus you're not protecting yourself. Uh-oh. Uh-oh. Yeah. Crush injuries, besides broken bones, cause destruction of tissue, leading to tissue cells popping open. You release potassium. It can lead to cardiac arrhythmias and can cause cardiac arrest. Cardiac arrest! Whoa. Whoa. Mouths like that, not normal for a human, but you see like sharks, they have multiple rows of teeth, potentially like this. And look at the lips, so they're very swollen. If a human had lips that were that tense, you always think, okay, is there an allergic reaction? Were they injected with different materials? And look at those eyeballs, that pupil is super dilated. The medical term we would call is mydriasis, basically big, open, related to your sympathetic nervous system, the fight or flight response. Whoa, is that a tumor? What is that thing coming off the side? Missing the right arm. That right side of the body took a hit. Even the lips are a different color, almost like black, would indicate gangrene and tissue death. Sometimes if it's dry gangrene, it won't necessarily cause an infection yet. Huggy Wuggy is definitely missing that left hand. No bleeding or anything coming out, so was able to get the bleeding to stop. Anybody ever has an amputation, find the limb as best you can, get to the hospital ASAP. The likelihood of reattaching something that has been amputated is pretty darn low, but you should get checked out anyway with that. Oh, ET phone home. Oh, all I see is a hand going straight through the back, coming out the front with some tissue flying out. Heart is center to the left. Sometimes there are people that have dextrocardia or situs inversus. So dextrocardia is when the heart actually goes to the right. Situs inversus is when all the organs of your body are flipped. You can have a puncture wound, cause bleeding, but you don't pass away right away. Movies, shows, games, it all shows immediate. It takes longer than that, unfortunately, and there is more suffering. Everybody be aware that these are not benign, simple things that, oh, this is how it happens in real life. Oof. Horror game injuries like this, it really makes me think being in the ER isn't all that different. That's actually why I formulated Chillax by my company Life Happens to help ease racing thoughts and keep your brain from feeling like it just got thrown into a horror game itself. Check out Chillax at lifehappens.com or on Amazon. Oh, we got an exploded injury.
Explodes.
Explosions, you always have to worry about the initial blast, and then the secondary injuries, and then tertiary injuries. So you can get initial injury from the heat, then you have debris, and then you have different organ systems that can be injured due to the compressive forces. A lot of things going on when you have explosions that can cause people to have injuries. Oh, it's shaken but not stirred. Oh my gosh. Everybody run! Direct hit through maybe the abdomen, through the chest. Pretty hard to go through the bone. You're going through not just sternum and rib, but on the backside, potentially going through all the bones of the vertebrae. Does it actually happen that way? Can that amount of force go directly through at one big swoop? Maybe. Poppy's still going. If somebody were to come to the hospital with that amount of damage to somebody's head, we're going to get a CT scan to make sure the underlying structures are okay, and then we need to figure out how to piece it back together. Are there skull fractures? Is it just soft tissue? When you have that many wounds on the skin and lined up like that, really hard to close up. Whoa. The color has changed of the prototype in the sense of burn injuries. The biggest thing we always worry about is your airway and breathing. If we see singed nose hairs, soot in the back of the throat, singed eyelashes and eyebrows, we're going to potentially intubate you and put you on a ventilator, because if you swell after, we might be too late. What is the goo? Bye-bye. Into the soup. This just reminds me of people coming in who spill soups, hot water, coffee, anything in the kitchen. We need to see the tissue. We need to see the wound. We need to potentially cut away any dead tissue right then and there, which will be helpful. If there are blisters, we typically will leave them intact because they're sterile. They're protective at that point. Sometimes if they're so big, we need to unroof it and remove the fluid that's there. Okay, here we go. Whoa, 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 whoa. Impaled into the chest, possibly. So if you get impaled into the chest, there's a potential of a pneumothorax, hemothorax, blood or air surrounding around the lung. And then if that fills up too much or too much air pressures into the chest, it'll collapse basically, and then push too much pressure on the heart itself and not allow it to fill up. And then it doesn't allow you to get blood back, which then you can't perfuse your tissues, and then you'll potentially die if it's not fixed. It definitely looks like a rolling pin, so it's not a sharp object. So it would take a lot of force to be able to actually impale somebody with that, because it's a blunt end, really hard to get into the tissue, to puncture the tissue, and then cause more damage. Oh! We see people who come to the emergency department all the time with mechanical falls. People fall down. People will literally fall from a standing position down to the ground and complain that they might have fractured their tailbone, which we call a coccyx bone. They can have a hip fracture. The question ends up being, did you have the hip fracture that caused you to fall, or did you fall and then get a hip fracture? The left arm just totally gets torqued in the wrong direction. We see people who get dislocations of the elbow or just spiral fractures of the humerus itself. A lot of times a proximal humerus fracture, or one that's at the shoulder itself, actually heals well on its own. But if it's a mid-shaft, we definitely want to fix that, and we always worry about messing with the major blood vessels. You have your brachial artery that comes down here. Whoa, 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 whoa. We can have a cervical fracture causing a major injury not compatible with life. It disrupts the information coming from your brain down to your body in your brainstem, which is basically your autonomic nervous system, where it's just telling your heart to beat and giving you your respiratory drive, those sorts of things. Oh! Impaled object that was sharp directly to the side of the skull. Basically on that side, you're going through your temporal lobe, possibly through your parietal lobe, and just depending if you're right brain dominant versus left brain dominant. And if there's enough bleeding, you're not going to be able to, survive this injury. What's happening? I just saw a head explode. Please, somebody tell me in the comments why that happened. Was it being strangled, or was there some other energy at play there? I don't know. Typically, the head is not just filled with a big ball of blood. The major blood vessels, your arteries of your neck and the veins of your neck, yes, they have a lot of blood there, but they typically don't explode. Obviously, if the head's gone, the body is going to collapse to the ground. Not like, say, a chicken with its head cut off where it's still running around. We don't have that continued function going on. You will see in certain circumstances after somebody does die, you might have some basic muscle contractions. Those are lower motor neurons, muscle fibers back to the spine and back versus anything going up to the brain. Holy cow. I am assuming that these characters have a ton of strength given the fact that they are robotic. The guy goes flying across the room. That obviously is not going to necessarily kill you unless you hit your head, have intracranial bleeding, skull fracture, cervical fracture, or you have enough blunt trauma to your chest that actually causes your heart to get stunned where it actually goes into cardiac arrhythmia. Head just placed right into a fan. We do see people who get injured by not fan blades, but a blade of a remote control airplane. I've seen really bad lacerations from that high-speed blade that's spinning. But if you're getting it to your face and say this is a metal blade, it's just gonna rip apart all the tissue that's on your face. Oh! Hook right into the hand. We do see people who get impaled, injuries to the hand itself. You can basically break the bones of the hand, or you can miss them, actually go in between them. And then you also worry about all the blood vessels that are running next to the bones, as well as all the muscles. Very integral muscles of our hands. That's why we can move them in so many different directions. Just sitting at my desk doing some work. Oh my gosh. I've never seen a guitar used in such a fashion. It looked like it hit right in the heart from the anterior aspect. If you have enough force, like that thing is coming out like a rocket, yes, that potentially can rip right through you. If I threw it, yeah, no, that's not going to impale anybody. What? You can push enough pressure that you can actually rupture somebody's eye and enucleate it.
Nuclear.
Basically have all that liquid come out of the eye. The major blood vessels around that area are more in the posterior aspect of it, not really much in the front. You'll have some bleeding, but not that much. Obviously, your eyelids are going to potentially close, or it's going to be an empty socket. Could you actually crush somebody's skull? Pretty hard to do unless there's a defect already, but even then, really hard to crush a skull. You'd have to be in a heavy-duty commercial machinery or flip it upside down.
Upside down.
And you fall on top of your head from a very high fall. These types of animatronic characters, they have immense amount of strength. Nuts. So you're taking that hook again right up almost at the base of the neck above the clavicle. So you actually have your subclavian vein and the accompanying artery going right with it underneath the clavicle. Gets choked out, it looks like. Sometimes if you take a lot of trauma directly to the neck itself, you can actually cause spasming of your vocal cords, which will actually feel like you're choking and you can't breathe. Oh, there you go. Fight back. Oh, and a broken arm. Fracture your arm, fracture of your humerus or the radius and the ulnar. Horrible, painful. Basically, it's going to swell up a lot because there's a lot of blood vessels in that area. We see people who come in with a upper extremity fracture, say of your humerus, and there's just pools of blood. There's not much to do. Really hard to actually splint this upper part of the arm. Obviously, you'll follow up with an orthopedic surgeon, and then they may or may not have you go to surgery, or they'll put a full cast on your arm all the way up into your armpit. Oh my gosh, that looks like a heart. The blood vessels coming off look appropriate for a heart. It almost reminds me of Indiana Jones and the Temple of Doom, where they take out the heart too. Probably all one color. Sometimes there's fat deposits around the heart itself and maybe a sac around it, and it'll be quite bloody. Somebody who's getting shocked like that, that is probably more of an AC current type of electricity. Typically, if it's DC versus AC, so alternating current versus direct current. A direct current, if there's a lot of energy, you actually get one shot and explode because it's like boom. Versus AC, it actually sticks to you basically and causes flexor contractions. Oh gosh. putting your head inside somebody else's mouth is probably not the best idea. Dental injuries, bite wounds, something that I do see in the emergency department. We see people come in with human bites, so somebody else biting you. Sometimes it breaks the skin. You worry about the different bacteria that can actually get embedded in. With puncture wounds, you worry about the bacteria getting seeded down. So if you actually suture it closed, you're actually sewing in the bacteria.
No!
Oh. What is going on?
What is happening?
Crush injury to the face. Crush injuries that we end up seeing are typically due to falls, bats, or hammers, or crowbars. And then obviously car accidents are a big one. A lot of times those will end up at a trauma center. Oh my gosh, okay, so electrocutions, they do occur commonly. The energies and the electricities are usually low. It can cause muscle contraction. If you're having full body, high energy injuries, then it can cause cardiovascular events, it can cause asystole where your heart just stops. You're always worried about the burning of the nerves, burning of the tissue. If there's too much tissue damage, what ends up happening is the breakdown of those cells. The byproducts of it end up going through your kidneys to be filtered out and actually can cause kidney failure. What is this hook as a hand and impale somebody in the head with it? It is probably not super sharp, but it's pointy enough that it can cause a penetrating trauma through the skull. Now it's hitting on the left side. If it doesn't go all the way through, you always worry about an epidural hematoma caused by an injury to the middle meningeal artery. Then you can also hit that parietal part of your brain, which ends up being a lot of important structures where motor function is, where sensory is. Basically choking this individual. It's cutting off airway as well as potentially decreasing blood flow in and out of the head.
Blood just drained from his face.
You can crush somebody's windpipe, trachea, and cause inflammation to where you can't get any air through the area. You can compress it down, which is difficult to do. And then the other component is the major blood vessels that are running along each side of your neck. Crush injuries by other people's hands. Obviously, it's not likely. Could it potentially happen? Obviously, there's always exceptions to the rule, but you wouldn't necessarily find yourself in a common situation where that would occur. Whoa! Facial traumas, facial injuries, they do bleed a lot. The face is so vascular, which in itself is actually a benefit because if there's any potential of wounds, the likelihood of them getting infected is pretty darn low and they heal really well. Same with the tissue of the face, that heals really well because of so much blood supply to that area. Oh my gosh. And then obviously, if there is a lot of bleeding, we need to clean it up as much as possible, find where the bleeder is coming from and try to get it to stop. First, always try to use compression. So push pressure on the area, hold it now for a little while, see if it actually self-heals. And if it doesn't, then we actually have different types of suturing techniques. This gurgling noise that we all believe to be basically somebody's neck is cut. We typically don't hear that very often in the emergency department. It's not super common to have somebody's neck lacerated and coming to the emergency department. But typically if that is the case, you want to secure airway first. So if the airway is cut all the way through,
Slit his throat from ear to ear.
you have the opportunity to either put a tube near where the cut is or through the cut if the trachea is accessible. Oh, that's a lot of sharp teeth in there, okay? All I could see is like puncture wounds, injuries. It almost is similar to like somebody getting bit by a shark because there's multiple layers of teeth there. A ripping, brutal type injury where it's not a smooth cut. So the tissue is very hard to put back together. A lot of times when somebody has really rough edged wounds, we actually have to cut some of the tissue away to be able to make smoother edges so we can actually bring the tissue together. Otherwise, it won't heal right. Is a trick.
That's bait.
What are we doing here? Oh, come on. I saw that coming a mile away. Facial traumas by potentially a bite. So you could actually have a lot of bleeding again. It's just like a superficial flesh wound.
Just a flesh wound.
You won't necessarily bleed out unless there's a neck injury. You do have some major blood vessels of the face that are basically branches off of the external carotid arteries. One goes deep inside and the other one goes superficial. Oh my gosh. Oh. Come on. Come on. Single knife wound injuries. We do see a lot of them depending on where somebody is injured. Depends on how we approach it. So if it's into the chest cavity, always worry about bleeding on top of a punctured lung or any major structures underneath that. Versus arms or legs, and you just worry typically about any major blood vessel, and then it's mostly a superficial wound. Anything into the abdomen itself, you worry about organ punctures. So a lot of times you'll get a CT scan and then possibly just go to the OR immediately, especially if it is very deep. And then obviously within the thoracic cavity, you also have your heart. The big thing is if the heart is punctured, you will potentially die quickly. Oh, blunt head trauma. Solid object to the skull itself. Your bone is the thickest in the front, but it also have sinuses here, so you can actually have a fracture of part of the sinus because it's basically a pocket of air, so there's a bone on either side. If there's a fracture all the way through, especially in the sinuses, you always worry about potentially a cribriform plate injury, which basically connects the brain to the face itself and the nose, so there's always an increased risk of infection there. If it's not a massively displaced skull fracture, most of the time they'll heal on their own, but you definitely need close observation. Oh, so he goes inside the suit. Okay. Oh! The spring locks basically malfunctioned, releasing in all different directions, causing it to impale, crush, and almost look like ripped tissue. So you could potentially have all of these massive injuries, and then the question ends up being, does it cause you to die from injuries super fast? It just depends on what organs have been hit. The brain was injured, spinal cord severed, if the heart was impaled, those sorts of things. The obvious things. If you lose 40 to 50% of your blood volume in a very short period of time, that's not necessarily sustainable with life. That's hypovolemic shock due to trauma, to where you're level 4 on the trauma criteria and you're basically going to die quickly. You're going to have end organ damage, you're going to have renal failure, you're not going to have enough blood to perfuse your organs, which gives the oxygen to your tissues and to the organs, and they're not going to be able to function. Other situations where we see crush injuries outside of like car accidents would be at like factories. Seeing people get crushed by big machines, maybe not paying attention or getting caught, and you can get crush injuries, you can get amputations due to that. But again, usually these are limbs. They're not full body. They're not basically surrounded by something that's going to crush them. Maybe if somebody was wearing like the Iron Man suit, that potentially could malfunction and cause injury. Whoa, 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 whoa. What am I looking at already? Gunshot wound right to the heart, right to the thoracic cavity. We can actually do a thoracotomy where we crack open somebody's chest to get all the blood clots out of the way, find the problem, and then close it. We got blood splattering kind of randomly. Typically, with these type of injuries, you could have blood squirting out. But if there's this much of an injury, this injury typically doesn't make it to the emergency department. Oh, we're going for an arm. Oh my gosh. If somebody has their arm amputated off like that, basically you need to get bleeding under control. Direct pressure, bulky gauze. If that can't stop the bleeding because it's a major blood vessel, your last resort is a tourniquet. The game having this audio in there, it's kind of disturbing. Actually hear these true sounds of an individual in the emergency department. It hits at your heartstrings. Very difficult situation to work in. A lot of times when we have these events, we actually have decompression meetings afterwards so we can actually talk about what's going on, because we're human beings. You don't want to bottle it up and cause more problems inside. But then did they bandage it up? Not sure what that character is doing, but it looks like there's a bandage that's put on and the bleeding has stopped. Now at this point, pick up the limb, get to a hospital ASAP. Okay, stay away. This actually looks like a table saw. We see a lot of saw injuries that come to the emergency department. Skill saw, table saw, freehand saws, lots of different types of saws out there. We see a lot of lacerations and amputations. Oh, when somebody gets a saw injury, a lot of times we'll end up getting an x-ray of somebody who has a laceration just to make sure it doesn't go into the bone, because if it goes into the bone, you get concerned because there's an increased risk of getting osteomyelitis. A lot of times people will come in to the emergency department. The bandage is either soaked with blood or it's wrapped. We'll actually take it off.
Gotta rip that band-aid off now. You'll thank me later.
Remove the clot, clean it with a lot of water, high pressure type of water, and actually anesthetize the area. And that way, at least while somebody's waiting for the imaging or waiting for the doctor to get ready to sew it up, you can at least be anesthetized and not feel the pain anymore. Oh my gosh, a knife wound. We get knife wounds a lot in the emergency departments. Maybe go just underneath the skin, could go maybe a centimeter. The concern with those is knowing exactly how far deep they actually go. So you don't typically just do blind probing with, say, a Q-tip if you're not a surgeon, because you can cause more issues. Very small puncture wounds, do you close them up or not? If, say, somebody is bitten by a dog, you typically do not close those up because you have an infection that might be seeded deep into the tissues. Versus a puncture wound by a blade, it's up to the discretion of the doctor, depending on the cosmetic repair as well as location. Okay, so the axilla, aka the armpits, you have major blood vessels that run through there. Obviously your neck, you have your carotids and your jugulars, and then you do have lots of superficial blood vessels everywhere. Even though it might not be a major vessel, it's still going to bleed, and the first thing you do is compression to that area. Put pressure on the wound to get it to stop bleeding. Who creates games like this? It's not like a game, you're just shooting things. Shotgun injury, we don't see those very often in the emergency department because usually they're quite detrimental. People typically don't survive. I have seen people come in with shotgun pellets still in their tissues, in their bodies, very hard to get out. You can cause a lot of damage to try to actually get those out. And then you always worry about future lead poisoning. A lot of times you can get what's called dry drowning and wet drowning. Is there water in the lungs causing a blockage of transmission? Or do you have spasming within the airway itself that blocks the ability to get air in and out? We actually see individuals that are attacked for no reason.
No reason.
We get people that come to the emergency department for every different scenario possible out there. Our job is not to really know about the story. Our job is to treat the problem that we see. We'll have individuals such as U.S. Marshals and Border Patrol and detectives and police officers. They provide some information, but they're actually there for a separate job as well. They're waiting for the patient to be medically cleared. Baseball bat injuries, it's a piece of wood or metal, fracture of a bone. You worry about something called rhabdomyolysis, and can cause renal failure, aka kidney failure. Other things you think about, hyperkalemia, so when a cell breaks down, the potassium is inside the cell, and if you have too much potassium that's circulating, it can actually cause cardiac arrhythmias and actually kill you. It's just a little disturbing to just watch because I see this in real life. Broken jaws, collapsed foreheads, broken eye sockets, eyes that are just coming out, teeth that are missing, all because somebody just used this type of baseball bat or object onto somebody's face. Here we go. Oh my gosh. When you see blood go into water, the blood seems like a ton. But if you take one drop of blood and you put it in a gallon of water, the whole thing's gonna get bright red. We see this a lot when people come to the emergency department. They show us a picture of the toilet because they're having maybe, say, rectal bleeding, and the whole toilet is full of blood. And it's like, well, it looks scarier than it is. We say, you know, after you have a laceration and we sew it up, don't soak it. Don't go into a bath. You can clean it off, shower, but don't soak it because it potentially can keep the wound open and it doesn't allow it to heal as well as it should. Lower extremity injuries, these are quite common. Vascular injuries we worry about. Other things are something called compartment syndrome. You can have an injury and then the injury causes a significant amount of swelling. The tissue basically cannot thrive anymore because there's no more oxygen, and then the tissue can potentially die. Relating to compartment syndrome, the pressures are too high, talk to an orthopedic surgeon and emergently do what's called a fasciotomy, which is basically the fascia that overlines all the muscles is this silvery white material that you actually cut to allow the tissue to swell more to get the blood flowing again. Typically, we don't see many explosive injuries. That is more military medicine versus civilian medicine. We do see injuries and events that are similar to it, car accidents, fires that could have some, maybe a propane tank explosion, those sorts of things. You worry about not just the injuries, but the burns. All I can think about when I see this is when you have a lot of different injuries like this, you have multiple people, you have to basically triage who's going to immediately die, who has the most life-threatening injuries right away, who could wait a little bit, different things, so you can actually help the most amount of people with the resources that you have.
The most amount of good for the most amount of people.
Oh my gosh, we are back at this again, taking a lot of bullet wounds. We see people who come to the emergency department with bullet injuries, gunshot wounds, okay, GSWs. We worry about entrance and exit wounds. We worry about the underlying organs. We do need to kind of gauge what type of weapon was used, because it depends on how the bullet's going to go through your body. People say all the time, no, bullets don't bounce around. They do. We see it all the time where they actually change trajectory. We actually try to first identify. If we can't see an exit wound or count the appropriate number of holes, we actually will end up putting paper clips or some sort of little piece of metal where a hole is, get an x-ray really quick to see if it correlates to where a bullet might be in the body. Oh my gosh. It's like blunt trauma. Initial blunt trauma, left lower quadrant of the abdomen. That's what I would infer here. You do have your pelvic bone there. That can get fractured. But the abdomen itself in the left lower quadrant, it's mostly large intestine. You do have some blood vessels. From a female anatomy, you'll actually have the ovary. You just worry about vascular structures in that area, making sure there's not a lot of bleeding. Also taking an injury to the right leg. You do have to worry about the knee joint, and then below that, you have your tibia and your fibula that you have to be concerned about fractures, dislocation at the joint, and then any contusion. When I say a fracture, I am meaning a broken bone. Then we'll describe if it is a hairline fracture, meaning it's just a crack through, or is it a displaced fracture, meaning there's a separation of those bone fragments. Fall from great heights. Great height in medicine is 15 feet or 3 times your height. This is not exact, okay? If there is a significant mechanism of injury from a fall, there is concern there could be significant injuries in your body that are not obviously seen, so you have to run it like it's a trauma. Whoa. And this patient would never make it to the hospital because obviously they will likely be dead. An axe on the beach. Sneak attack. Oh my gosh, we got an arm that has been severed off. We talk about tourniquets. In this case, if the severed arm is so close to the axilla, aka your armpit, where are you gonna put the tourniquet? It wouldn't be a situation where you can actually put a tourniquet, but you do have major blood vessels. A lot of times when the blood vessel gets lacerated, cut, totally severed off, it actually retracts. Oh, we got a lot of destruction to the legs. Biggest thing you always worry about is your femoral artery, femoral vein. The major blood vessels there are right at your groin. You can feel them. And then they actually dive deep, kind of midway down behind the femur and then go behind your knee. It's very interesting that we have it there. If you have an injury that's down to your lower extremity, then you potentially can use a tourniquet. You can use cloth. You can try to use a belt. The belt is hard to cinch down, but you need something to kind of spin to tighten it and then hold it into place. I've seen people come in, their forearms or their biceps, or different parts of their body have been ripped off due to bullet wounds. Biggest thing that we do when somebody comes in that situation is to basically get the bleeding to stop. Now you want to check the neural function, and then you want to check how intact things are. Oh my gosh. Shotgun injuries depends on the type of round that's being fired. Is it those super small? Is it one big slug? We see people when we get x-rays, they've had previous injuries and they're just like spray painted with a bunch of little pellets everywhere. People always ask, like, hey, can you get the bullets out? Can't necessarily get the bullets out because you're going to cause more problems. Typically, they just sit in there, and unfortunately, a lot of them are made of lead, and you have to worry about future lead poisoning. Running down a hallway. Oh, stairs. Oh, man. We see falls down one step and many steps. Sometimes you literally can just twist an ankle off of one step and you sprain it or break it. Versus you fall down a full set of stairs and nothing happens. That is a tough fall. Holy cow. It's the longest set of stairs ever. We always ask, were the stairs covered in carpet? Was there any other injury? Did you fall sliding down on your butt? Did you go, head over heels, tumbling down? It helps to describe it to us so then we can think about the mechanism of injuries that might happen. And we're still going.
1 hour later.
I don't think you can survive that. I mean, maybe you could. If you're falling head over heels, then there's a lot more areas that could be injured. We'll do a full head-to-toe assessment, palpating all the different areas that you would think they would be injured, but basically pushing on the skeleton and making sure no area hurts. If that area hurts, obviously we do imaging to double check. Holy cow. That was a very, very, very dramatic fall downstairs. If it's massive falls, you may end up doing CT scans as well. Just depends on the injuries. The biggest things you worry about outside of fractures of your long bones of like your upper and lower extremities would be cervical injuries. Typically, most people would be put in a cervical collar and everybody hates it, even though it's trying to protect you from causing more potential damage. We see people get hatchet injuries.
You know what a hatchet is, don't you, Bug?
The sharp edge, but not like super sharp, so it causes a lot of like blunt trauma with some lacerations. We sometimes can see some fractures of bones with this due to the mechanism of hitting a limb with it or people trying to block their bodies. Brass knuckles, the concern is because you're hitting somebody with metal, that is going to cause a lot of soft tissue injury and fracture. We shouldn't be using this stuff, not hitting each other, not shooting each other. Breakdown of tissue releases potassium into your system, into the bloodstream, because they're typically in cells. And so when somebody has that, we worry about something called hyperkalemia. Too much potassium can cause cardiac arrhythmias where you can go into cardiac arrest. Cardiac arrest! The other thing is you can actually cause rhabdomyolysis. You see this a lot when people work out too much, but also could happen in burn victims, can happen in somebody who has a lot of trauma to their tissue. The byproducts of the broken down tissue clog up your kidneys and you can go into renal failure or kidney failure. Blunt trauma to the head can cause skull fractures, could also cause intracranial bleeding. The biggest thing you worry about is the epidural hematoma that's typically caused by a middle meningeal artery. Then you worry about a subdural hematoma, which again is typically due to trauma. We see it on imaging. It looks like a crescent moon. Say there's a ton of bleeding. You might actually do a ventriculostomy. A neurosurgeon will come in, they do a burr hole, they put a tube into the lateral ventricle on the opposite side to drain out your CSF to give you more space. Okay, a close range rifle shot to the right lower extremity. You can have significant destruction of the bone, or it can miss and go straight through the tissue versus I've seen somebody's leg almost torn right off. Just like that. In that circumstance, if there's still a proximal limb left, meaning there's still a piece of limb, tourniquet that, get the bleeding to stop. We're getting shot right in the left groin.
My groin!
Right where the femur hits into your abdomen and your pelvis. What major structures are in that area? Male, it's just got basically some intestines down there. Female, it's got your intestines and ovaries. Ureter in the back, there's other tissues there, but those are the big ones when it comes to organs. And then we're talking major blood vessels. So we're having your femoral vein and artery as well as the femoral nerve that comes out right there. Gunshot wounds to the left upper extremities. Blood vessel wise, what are we worried about? You were correct if you said the brachial artery. Brachial artery runs right along underneath your bicep here. That is the go-to place that we're trying to feel for a pulse in like a neonate and a very small baby, but it also bleeds a lot. Put pressure on the area, you can get the bleeding to stop. Oh, just pushed off. An example of just a fall from a massive height. You've heard me say this before on the channel. If you fall greater than 3 times your own height, that's considered a major trauma. We might do head-to-toe CT scans. We might do different types of x-rays on your limbs. A lot of times people with those heights might be jumping off something, thinking that they are like parkour people and then land wrong. Parkour! We worry about calcaneal fractures that then actually take all the energy up, and you can fracture your back or your spine or even all the way up to your neck. Oh, laceration to the face. Face bleeds a ton. Direct pressure to the area will significantly help the bleeding to stop, and the face heals really, really well. So if you can get the bleeding to stop and just put a couple stitches in, suture it closed, you won't lose a ton of blood that way. We want to make sure that you have a good closure, so you have a good cosmetic repair, so you don't have a big scar on your face. If you do end up getting a scar on your face, you can always see a plastic surgeon for scar revision, and there are ways and different products out there that you can use to help reduce the scars. Ooh. Ooh. 4 gunshot wounds to the head. The amount of bullets that somebody takes doesn't necessarily mean that every time makes it worse. I've seen individuals shot once and not make it, and I've seen individuals shot 10 times and survive without any problem. It all depends on location, caliber. Everything is individualized of the case that happens. Oh. I didn't even know there was a car in this game. Pedestrian versus car. Fractures, dislocations, hematomas, contusions, amputations, intracranial bleeds, intrathoracic bleeding. We see so many people come in altered head injury, hematoma to the head, and they have a subdural hematoma, or they have a subarachnoid bleed. All these different areas of the brain that are bleeding, and it's like, oh, damn it. If you're a little bit older, you have more space in your skull for bleeding, so you can accept more blood. Our brains are shrinking as we get older. Oh, come down. Oh, man. Trampoline! When I was in residency, a trampoline park literally opened up like 2 miles away, and the amount of orthopedic injuries that came in after their opening was huge. Orthopedic surgeons are like, is this even legal? Broken wrists, broken ankles, broken tib fibs. Those are kind of the common injuries that you would see. Besides your simple sprains, are you going to succumb to the injury? Probably unlikely unless you impale yourself on something. Oh, the ledge. It's just like a goo. Okay. Oh, I don't know what type of liquid that is. It is green.
That's green.
In typical situations where you're underwater, you're trying to hold your breath, and there's a little bit of panic, your heart rate's beating a little bit faster, so your demand is a little higher, thus you're going to need to breathe faster. Injuries that we see when it comes to near drownings or drownings has to do with what happens immediately when you hit the water. Sometimes you can have just a laryngospasm of the vocal cords lock up, you can't get breath in, and then you can be inhaling water into your lungs. Oh, 2 wounds to the left upper extremity, getting hit with a blunt object with some laceration. The humerus is the bone that is from the shoulder to your elbow. That can fracture pretty easily with blunt force like that. Depending on you as a person, your activity, what you're doing, where the fracture is, sometimes the surgeon will not fix it, put you in something called a coaptation splint, and have the weight of the arm plus that cast, pull the arm down a little bit, get it in perfect alignment, and the body just fixes itself. It's the worst when you have a blown eardrum where it ruptures open, you get a little bit of bleeding, pain to the area when that eardrum ruptures, so you get tinnitus, that ringing in the ear. These will typically heal on their own, but you just want to make sure you don't get water in your ear, so you don't want to increase the risk of getting an infection. And if they don't heal, you can always get an ENT to do a tympanoplasty, where you get a new eardrum made. The crusher. Oh, yeah. So it's horrible. It's just a crushing machine. Now, we do see people that come in with crush injuries. I used to work in an area where there was a lot of industry. Hands were crushed, or people would get arms or limbs crushed against the wall from like a vehicle. If you have a crush injury and you're coming to the hospital for it, besides the tissue damage, you worry about secondary issues relating to renal failure and hyperkalemia. Oy vey. Chainsaw injuries. If somebody uses it, you just have to worry about it kicking or bouncing back, hitting them. They do cause a lot of tissue destruction, and sometimes you need to debride the tissue even more, cut off the dead tissue, and try to approximate wound edges, and might need skin grafts for the wounds to heal versus actually just pulling this tissue together and allowing it to stretch a little bit. You might have a big scar, but everything is covered. Really interesting are pupils. They dilate or they constrict. So meiosis versus mydriasis. This is regulating the light that goes in and out of our eyes. So if it's really bright out, we're gonna constrict down. And if it's really dark, we're gonna dilate up. It's like some rough, heavy metal. I feel like I'm gonna have a seizure. When your autonomic nervous system kicks in, your fight or flight, you're gonna dilate up. You're gonna run away from the bear and you need to run and see everything and take in all the information. Oi! Multiple different injuries to the head with the red stuff. This is actually quite common in the emergency department. People fall is probably the most common reason why you have head injury. The biggest thing we also worry about is cervical spine injury. A lot of times people who do have these falls will put in a seat collar, they'll get evaluated, and then we will check first a nexus criteria, which is criteria for examining the neck. Look at that neck! We need to get a CT scan of the neck. The blade comes out and the door shuts. I think that's a smart move. Having some hyperventilation, breathing really fast. What ends up happening is you're actually blowing off a lot of CO2. If you blow off too much, you're gonna get carpal spasming. We actually try to get them to breathe into a bag because we want them to keep some of the CO2. Midline thoracic injury, hard to do. You have your sternum in the way as well as a rib cage, but you can go in between. I've seen that before where somebody slips a knife in between. Mr. In between. You worry about puncturing the heart, either the atriums or the ventricles or even the aorta. Seriously detrimental things that you have to worry about. If there is a hole in the heart, you don't know it truly until somebody significantly has bad vital signs, really poor clinical presentation. We have a cervical neck fracture. Osteopathic physicians as well as chiropractors do a technique relating to the cervical spine manipulation. The idea is to put your body back in balance. Oi! GSW, gunshot wounds, single bullets to somebody's cranium, aka head, yes, can cause detrimental effects. And sometimes it might skim off, sometimes it might cause some bleeding, but survivable. Depends on caliber, distance, and what area of the brain is actually hit. Small hole in, bigger hole out. Oh, geez. Oh, wait a minute. Hole straight through. So I don't ever see that. Facial lacerations, but without hitting the eyes. Likely you're gonna hit the eyes and you're gonna have an open globe laceration. The biggest thing with those injuries is not to touch it. Don't touch it! Because of the fluid, you wanna make sure that you just close your eye and maybe have a protective cup over top of it. Massive facial injury. You can have a lot of facial injuries and still be kicking. It just has to do with the amount of blood loss that you're having, so you can't perfuse your organs, and then thereafter, okay, how do we repair this? Massive injury to the lateral aspect of the neck. I always discuss neck basically between your collarbone up to your jawbone. Highly vulnerable area of injuries. Your major blood vessels are there on both sides. You can bleed out pretty well. Interesting. This character ends up wiggling and dancing on the floor. Is somebody passed out? Are they in pain? Or are they actually having a seizure? Typically, seizures are rhythmic versus we see people who shake and move in all different directions. Sometimes this is a psychogenic seizure versus a hypoxic event. If somebody's actually truly having a seizure, roll them on their side, pad their head. Don't try to stop the shaking. Do not put your fingers in their mouth, nothing like that. Typically, seizures will stop after a minute or two. Oh, trying to help. We can actually tell when somebody's in a lot of trouble just at the way that somebody is breathing. Shane Stokes versus Kuzmal. Sometimes we see agonal breathing. Those we do not like. We need to intervene because soon that's going to stop. And then with no oxygen, you're going to go into cardiac arrest. Cardiac arrest. Massive traumatic injury to the brain. You can have bruising of the brain sloshing back and forth without skull fractures or rupture of blood vessels. You can have subdural, epidural, or a subarachnoid type hemorrhaging. Uh-oh. Oh my gosh. I've actually witnessed people who actually bite other human beings and have to come to the emergency department. People are not for biting. Please don't do that. Could you live without half of your brain? Could happen. I do see people come in who've had massive injuries where half their brain is gone and they're still around. Now they're not 100% themselves anymore. Oh, projectiles. You have a rebarb, say, through you. If it's not so big and long, I do not recommend pulling it out at this point. My classic line, please do not pull this out. Whatever it's damaging, it's still holding it together. This is either through the lung, this could be through your liver, this could be through any intestines or your stomach. Uh-oh, that's never good. Uh-huh. For some people, watching or playing something as intense as Sprunki might make their heart race. That's where Chillax comes into play, to help find calm vibes when life throws unexpected chaos your way. If you want to learn more, check out Chillax at lifehappens.com or find it on Amazon. Do Matrix Duck. Oh. I've seen circular saws take fingers off. I've seen big machines that do crushing where people get stuck and they end up losing hands. If anything happens like that, control the bleeding, bring pieces if they're not on you quickly to the hospital. They're not happy here. Get in there. Oh, it's like a whole family. Interesting.
Interesting.
We got a lot of bandages. We got some people on the ground, the young ones. Pediatric patients, when they actually come to the hospital, the whole place gets really nervous, especially when it's not a pediatric hospital. We always want to make sure that the patient's doing okay. Every single ER doctor is trained in pediatric and adult medicine. There are doctors that are specifically trained just from pediatric emergency medicine. What the heck? All I see is significant excess of lubrication of the eye. So I'm assuming these are tears, but we have patients that come to the emergency department often where their eyes are tearing a lot, and it could be for multiple different reasons, because you have a foreign body or a scratch or an infection. Oh geez. Interestingly enough, we do have patients that come in chains, and that's because they're with law enforcement, typically due to being incarcerated. Incarcerated. But we don't use those chains to restrain individuals. I mean, we don't have knives that just slice like that. In the emergency department, we may do that type of procedure during a perimortem C-section, but again, we're calling typically OBGYN in-house or a surgeon in-house to help with that procedure. It's very rare. What? Okay. We all know I don't know what's going on half the time with this. Oh. Boy. I'm just laughing. Okay. I feel like I'm hallucinating. This might actually be a true experience for patients that come in. They may have auditory or visual hallucinations, or it could be related to a mental component versus a physical component, meaning is there a brain tumor that's causing a problem versus is it an abnormality in the chemical makeup? Yep. I mean, taking out the heart, but it looks like a kidney. Kidney actually looks like the kidney beans. Our kidneys are in that shape. Most people have 2 kidneys, 1 heart. If you don't have any kidneys, you have to go on dialysis to help clean out the byproducts of all our cellular debris. I've gone to a shooting range before. If you shoot a gun without any ear protection, it's gonna hurt a lot. And even that much noise could actually rupture somebody's eardrum, cause tinnitus or ringing in the ears. You can have disorientation and then even decrease your hearing in that moment. Oh, nice relationship. Oh gosh. Do eyeballs fall out that easily? No. Remember, eyeballs are attached by your optic nerve, and then you have 6 muscles of each eye. Oh, so really cool. You see how the eyes are wiggling? We would call that nystagmus. We would look at that for different reasons. It's like when the police pull somebody over for drunk driving or suspicion of drunk driving, they're looking for nystagmus. Basically horizontal nystagmus that's not fatigable. Oh man. Oi. Potentially traumatic brain injury due to falls. Super common. We see this in the emergency department often enough that we get CAT scans of the areas because the CAT scan is fast. It looks at bone, looks at bleeding, looks at any structures that would need fixing in an emergent setting. Just look how perfect the teeth are. Like, that's pretty impressive. I want to know what dental plan they're on.
Dental plan!
Oh, getting hit on the side there. We always worry about something called your middle meningeal artery. It can cause an epidural hematoma. It can bleed and rupture, get a bad headache, maybe pass out, but then later on, it actually can cause worsening symptoms if it continues to bleed. Injection into the neck. We don't do injections like this. You get in the jugular vein or maybe the carotid artery, get it directly into your system. It's pretty hard to do that. It's protected by the sternocleidomastoid, that big muscle of your neck, and there's other muscles all around that area. Oh. So here you see the pupils look like different sizes, so that's something called anisocoria. This could happen naturally, or it could be related to a brain abnormality. So if you ever notice that your eyes are different sizes and you never had that before, maybe get it checked out. But if you had it your whole life, it's probably just a normal variance for yourself. What the? Weird chaos, tons of injuries, stress levels spiking maybe? That's where Chillax by my company Life Happens could help out. Chillax is an occasional stress support supplement that I co-formulated. Find Chillax at lifehappens.com or on Amazon. Never seen eyeballs fall to the floor. The only other things that like fall to the floor at the hospital that always get me like cringeworthy is like a baby's pacifier. You need to clean that really well. The floor at the hospital, even though it's cleaned and wiped down, it's dirty. Oh, stand in your ground. Did I ever tell you that my grandfather on my mom's side took an axe to his head by accident? He survived. Oh. Yep. Wow, that stinks.
It stinks. It stinks.
Massive trauma to the thorax, to the upper part of the chest. Your major blood vessel comes right off there. Say your heart is like right here, but your aorta comes up. This is just blowing it to shreds, and you're not going to be compatible with life even after a couple seconds. Oh, maybe not so much. Wow. Where were you before? Really interesting. We see there the depiction of multiple holes. In this case, there's too many. But there are scenarios where somebody has been injured with 10 shots and they survive because it's all hitting different areas or vital organs. So you just have to deal with soft tissue injuries versus, again, one perfectly placed shot. People will try to hurt each other with a blade going to somebody's skull. And I've seen it where it bounces off and causes soft tissue injury or arterial bleeding to the scalp, and it's a bloody mess. You gotta break down that blood, clean the wound quickly, and get it to close up. Sometimes it's just squirting everywhere. You can't just put pressure on it because you have to close it up at the same time. So you're covered in a face shield.